My name is Alan Soon. I live in Vancouver, British Columbia, Canada. And I think the favorite part here is we are sandwiched in between the Pacific Ocean and the Rocky Mountains. It's a beautiful part of the world. We're very blessed to live here. I'm an avid golfer. It's been a good blessing in this pandemic. It's one of the few sports that we were still able to continue to enjoy. And as you know, if you're a golfer, it's a perfect socially distant sport. You're outside, of course, and you don't go anywhere near your playing partners. So that's been really good. And in terms of my mental health, just being able to get out. I was diagnosed in February of 2019. So at that time, would have been 45 years old. Symptoms were quite innocent at the time. It was really a cough that started right around Christmas and just continued on into the new year. And my family doctor thought I actually had pneumonia and just wanted to do an x-ray just to be sure. And that's kind of when it all started. He saw on the x-ray that something didn't look right and asked me to get it checked out further in hospital. And yeah, that was when I was first diagnosed. I've gone through many of the lung health virtual events, virtual meetings and things like that. So it's typically very well organized. We've got good representation across the country. So we're able to share our stories from literally coast to coast. So from that perspective, it's been good. I'm not sure I actually decided to. It was just very natural for me. I think it's a function of me wanting to use my time better. Now that I'm not working, I wanted to really share my story. And if I can make the next person that gets diagnosed after me, make their journey a little easier, I think that it's been worth it. I think it's important to share my story, to tell people that just because you don't smoke doesn't mean you're not going to get this disease. It really doesn't discriminate. So I think that message needs to get out more. My hope is at some point that we can treat this disease as a chronic disease, like diabetes, like high blood pressure. Like I said, there's been a lot of research that's gone into lung cancer, but we still need to continue to invest dollars and get a robust screening program. I think that's the only way we're going to be able to move that survival rate needle, is to get people diagnosed earlier on so they can actually get cured of this disease. Like lung cancer we're behind. I think we're behind for a number of reasons. It's the stigma of smoking doesn't help. People don't typically give money as generously to what they view as a smoker's disease. You don't have that same problem with breast cancer. So research dollars to lung cancer is far, far less. And therefore the pace of advancement in lung cancer research also gets impacted.